Twice a day to floss or once a day, doctor? Coffee, good or bad? What about taking sodium bicarbonate?
And patients have asked that before, and it's a wonderful question.
Hey, everybody, it's Dr. Mitch, and you're watching the Wellness Podcast by Hugh Light USA. Now, you can watch or listen to this podcast, which is going to be super amazing today. You can watch on YouTube, Spotify, Amazon Podcasts, Pandora, Castbox, iHeartRadio, you name it. You can watch it anywhere you want. Please subscribe and follow us to stay notified when we release new episodes that you won't want to miss. And for more information, just visit HughLightUSA.com. It's HughLightUSA.com. I'm a little excited because the guest I have today is absolutely amazing. I call him my brother, and he is my brother for sure. And he is one of the probably premier endodontist in the country. Now, you could probably say right now, Dr. Mitch, why would I want to listen to this podcast about talking to an endodontist? Well, that's a root canal specialist. And you're thinking like, yeah, I'm going to stay as far away from him as possible. Yet, you're going to learn so much, and you're going to finally recognize, hopefully by the end of this short podcast, that the mouth is still attached to the rest of the body. And what happens in this area here makes a huge difference to what happens to the rest of our body from head to toe. First of all, I want to welcome Dr. Terrell Crawford. He's a dentist, endodontist. Dr. Crawford, give us your background. Let the folks watching this podcast know exactly who you are, and then let's delve. Let's go for it. Please give us a short, who are you?
Yes, sir. Thank you. As always, a pleasure to be with you, Dr. Mitch, you and your audience. Thank you so much. I'm actually originally from St. Petersburg, Florida. I was born and raised and ended up leaving for the military after high school. I actually enlisted in the United States Marine Corps. Upon which, finishing my enlistment, I decided to go into some form of medicine. Did not want to do general medicine, quite simply because I felt that in my particular situation, I could do more for the community and be more of a beacon as a dental professional, because I did not have many dental professionals on the south side of St. Petersburg, where I was born and raised. Following the successful enlistment in the Marine Corps, I decided to go to Florida State University. And upon completing Florida State University, I ended up getting accepted as a dental candidate at Temple University School of Dentistry, which is now called the Kornberg School of Dentistry in Philadelphia, Pennsylvania. Following a successful 4-year program there, I was accepted to a general practice residency, which is a residency program attached to an actual hospital. So you do rotations through different specialties, subspecialties, and disciplines. You will perform, intubation. You will even do pap smears. You'll do a whole host of things. And you may be saying, wow, but you're a dentist at that point. But it was great. It was just an actual opportunity to see all of the facets of medicine and how the actual mouth truly is connected to the rest of the body. Well, following the actual program completion at the GPR, which was in the Bronx, Lebanon Hospital, I was accepted to a specialization program with Case Western Reserve University, and it also had some lateral programs with the Cleveland Clinic. So I proudly wear all of this in just a very succinct, sleeve here on my shoulder. You can see where I pay homage to the United States Marine Corps, FSU, Temple, Bronx Lebanon Hospital, and Case Western. So in the many offices that I go to, a lot of the patients they don't see all of the diplomas. They don't see those 13 years of education, proudly paraded on the wall. So I wear it on my sleeve as a badge of honor.
And I think you should. You know, as well as I know you, and we know each other very well. Do you know I didn't know that you were in the Marine Corps? Hoorah. I thank you so much for the service, number one. And we'll talk sometime about that. And I also, I'm a Temple graduate. So I
That's
went
right.
to Temple too. So the two of us have so much in common. Let's get into the things that people are wondering why in the world would I have a dentist, let alone an endodontist involved in. I want to first talk about, if you could, the association of the mouth itself, the dentist, the gums, the whole thing, and that association to disease of the body. Now, most people completely ignore it, no matter what disease or what doctor you go to. And I would have too, unless I've had the great association with you. So, how does that come into play? And I think what I would like you to do with this is set the stage for the questions I'll ask afterwards, which basically is, what are we going to do about it? Because I know how important it is because of you. And I want you to tell the folks that's watching this podcast why it is so important to recognize the combination of mouth and body. Go ahead.
Yes. So as a result, even in Eastern medicine, it's been directly correlated with the overall general health to be a sum of all the parts of what we will consume or place on the inside of our mouth. Believe it or not, there's over 700 different types of bacterium or microorganisms that range from bacterium, it ranged from fungus or fungi, as well as viruses that reside within our saliva. Now, granted, we have protective mechanisms such as amylase, certain enzymes, but it is the accumulation of these microorganisms within the plaque or within the actual acquired pellicle, which will actually enter through what's called a portal of entry. So the portal of entry is typically going to be some form of direct pathway into our system. It could be through the actual enlarged sulcus, which is the actual kind of crypt or the kind of moat which surrounds each and every tooth within the mouth. So this will
Mm.
actually, believe it or not, kind of open. It pulls away from the actual tooth because it's lost its ligamentary strength. All of these things come from the fact that bacteria produces heart disease, kidney disease, liver failure, things of these nature.
So, what you're saying is, and the people must understand this, that the mouth is it a minor, a mid, or is it a major sort of portal for these 700 different types of bacteria, which probably represent trillions of bacteria, to get into our bloodstream and go to these places to cause everything from heart to kidney disease, like you're talking about?
Absolutely. 150% correct, Dr. Mitch. What happens is that you said it correctly. This portal of entry it initially starts off very small. However, over a period of time, it will exponentially increase the chances of developing all of these different types of maladies or diseases or diseases. So it is in actuality, a major, not a minor or a mid, but a major, portal or way for disease to start, as well as manifest and to, promote throughout the body. Absolutely.
So you mentioned about amylase. For those listening, it's an enzyme that breaks down starches. I always had a difficult time thinking about that because, the dentists in general say, eat less sugar, you got a cavity. I had my tooth looked up, my teeth looked, they said, and I had a couple little tiny cavities. They said, oh, you eat less sugar. And I'm thinking it's kind of weird. God made us to have this amylase, which is the only enzyme in the mouth, and it breaks down sugar and starches. But yet, I guess I'm not sure how I understand it. Is there another reason we have amylase in the saliva, or is it just to break down the starches and sugars in our mouth.
Well, that's part of the reason, but also it helps to prevent and retard the actual accumulation of or the congregation of a lot of these microorganisms. So by having these
Okay.
enzymes and helping to prevent these colonization or these CFUs on different parts of the actual teeth or the tooth, it will help to kind of stave off. It will help to kind of prevent these disease factors. And although the amylase, this enzyme, has been highly effective in natural sugars, it is the highly processed sugars which it is not as effective against. So highly processed sugars are just really, really bad.
Yeah, so now I think I understand a little bit better. And one other thing that I'll just throw out, and then I'll ask you some other in a different area, is that I'm quite aware if the pH changes, due to what we eat, what we're exposed to, and so forth, and the pH in the mouth changes significantly, then the amylase becomes not able to work as well, if I understand correctly. But we're talking about pretty much that there's a microbiota or a microbiome that everyone knows about the gut. I think they forget that we have other areas, skin, vaginal, lung, and the second largest outside of the gut happens to be in this mouth of ours. And when it's in balance, we're okay. When it's not, like you're suggesting, we have a problem. Now, I guess people watching are saying, "Yeah, who cares? How many people are not in balance?" Well, I guess the answer would be how many people at any given time, if you know an approximation, have either a gingivitis, inflammation of the gums because of inappropriate microbiome, or actually have a periodontitis, which is a bone problem. Do you have any idea what that actual number might be?
Yes, absolutely. It is roughly right around about 72%. So
Wow.
72%, that's a large number. And again, they have found where these microbiota, these microorganisms, which enter through the actual portal of entry, have been found in plaques within the brains of individuals who suffered from dementia or Alzheimer's disease, Parkinson's.
Whoa.
So these bacteria, these organisms, microorganisms, because I like to be, correct, it's not just bacterium. It is a whole host of microorganisms which are
Right.
causing havoc within the actual the systemic health. So as a result, when you start to take samples and you're starting to look at the correlation and you're starting to really look at the data, it is owned through a holistic overall approach to health that you can truly become healthy and you can truly stem dis-ease or disease.
Yeah, I'm hearing this, of course, not for the first time, because, of course, you're a regular guest on my television program. But it is profound because I think, like I said at the beginning of this podcast, folks are not as tuned into. They'll come in and say, "I eat perfectly, my gut's healthy," but rarely will they say anything about the gums. And I always look in someone's mouth when I'm seeing them for the first time, regardless of what their disorder is, and you could see, plaque and tartar behind the teeth and things that all suggest that there is biofilm, which we'll talk about a little bit, and also suggest that there is some sort of disease in the mouth itself. I guess what the is the answer. I'm going towards prevention now, just to give you a moment to think about this. Is the answer prevention? Is the answer just going to the dentist every 6 months? Is the answer just what you do at home? How do we? I mean, 72% blows me away. That figure just drops me to my knees because I'm thinking that means that of the people watching this podcast, more than 7 out of 10 have some sort of gum disease, which means 7 out of 10 have this microbiome or this diseased mouth s- putting into the general circulation, which makes the immune system work even that much harder to try to not cause disease. So, what are we doing wrong? First of all, what's the dental community? I'll let you, it's good if you can. If you can, critique yourself being the dental community, and then what are we doing wrong as doctors? And then what are we doing wrong as patients? And I'll interject in between.
Yes, sir. Great question, by the way. It's really centered around the status quo. Okay. The first thing is that a lot of clinicians, unfortunately, they do not question outside of what they're taught. So when they get out and they're just following, this regular
Mm-hmm.
regiment of what they've been taught in school, however, as
Yeah.
antiquated as it is, it will help to promote,
I
prolong.
love you so much. I love you. I know I'm off script here as far as at least asking you the question and letting you answer. It just makes me smile because, and then I didn't mean to interrupt you. I
No,
apologize
that's good.
profusely. But when you say something that's so important that people need to hear, it's that old thought, stay in the box, shut your mouth, and do what you're told, which may have or may not have, I'm just saying, some secondary gain for some community. But when you're thinking out of the box, which what you're talking about is so important. Go ahead.
So, what happens is, believe it or not, we've been taught fluoride, 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 fluoridation, and that's not true. I don't want to cause a tizzy, but when you look at the actual the literature, fluoridation is really not as good as we've been taught. It actually is a poison,
Mm,
and there are so many other different treatment modalities. One of which that you've brought up to myself on a previous interaction with the use of gold nanoparticles. Incredible. We've got lasers.
cool.
We've got so many other treatment modalities. And whether or not it is cost, the status quo, we are just not promoting that as a profession. We're just going in, literally drilling and filling, chasing decay as
Mm.
opposed to preventing. And of course, it's much more lucrative to be reactive as opposed to being proactive and preventative. So,
Listen, I have a question.
yes,
We'll go back to this because we really need to hear your words on this. It's that important. If they went to the dentist and they say, "Oh, you have time," they're going for their typical cleaning. They have no symptomatology. They say, "Hey, you've got a couple of cavities here." The instant thing is, "Oh, set that person for a appointment, drill, fix the cavities." Is that still in your mind the way of doing things? Or should that person go home and try to do something else first? Or would that be a mistake because it can make it bigger? What's your take on that issue? Because that happens to a lot of people that are watching.
right. The first thing is to make sure that you are being seen by a reputable dental professional. And I just don't say dentist, but a dental professional, whether or not it is a hygienist, a dental assistant, or a specialist or a doctor, because of the simple fact that, you may have totally different, outputs as far as receiving treatment or receiving opinions on what to do when you incur cavities or caries or lesions about the teeth. Sure, if the lesion is extremely small, it can remineralize based upon your diet, so forth and so on. Now, if the lesion
Mm,
is large enough and you actually have symptomology or pathology, there is a school of thought, and it is backed up by current as well as past literature, classic literature, that the teeth have a ability, and the nerves, which is called the pulp, has the ability to rebound to a certain degree. So this rebound is going to be based off of several different factors. Sure, nutrition, the actual type of microbiome that you may have. If you're consuming complex carbohydrates, if the pH is extremely acidic, if you're an individual who, say, for instance, you have the perfect mix for that lower pH where you're consuming, say, for instance, colas.
mm,
Coca-Cola has been measured at a pH of 3. If you are consuming the standard American diet, say, for instance, as we talked about one time before, a small 2-ounce bag of potato chips, which is fried in either seed oil or peanut oil, some type of hydrogenated oil, can cause inflammation within the body for 3 weeks. This inflammation will open up that portal of entry, will allow for everything to kind of, become absorbed and attained within the body. So it is a whole, gambit of things that you've really got to kind of do your due diligence on.
Okay, let's have that preventative. Whether you have a couple cavities or we're doing what you say, let's prevent. Let's have the ABCD. I'm a lay person. I don't know anything close to what you know about the mouth. What do I do? What's the ABC? Do I floss and then blush, or do I brush and then floss? How many times a day do I use any mouthwash? How many times do I go to the dentist? What can I do? What's my ABCs of keeping this microbiome, these teeth healthy and as far away and being in the 29% 29% of people or 28% who don't have gum disease? Go ahead, Dr. Crawford.
Right. It's going to be compliance with what your dental professional advocates, both verbally as well as even pulling out an actual chart or even a model to show you. So this compliance is going to really be based upon your ability to have manual dexterity. And if not, you can always utilize a electric toothbrush. You want to brush your teeth, and you've been told this. People have been told this all the time. But however, we're not the most compliant species. Let's just put it that way.
Yeah, that's correct.
Yeah, absolutely. Even I'm an endodontist. I had to even go out and purchase electric toothbrushes with the 2-minute timers for my children because they go in and okay, we're done. It's like, wait a minute. I know how much I know the whole root cause behind tooth decay. I understand the premise upon, getting from A to Z, so forth and so on. So we're going to act in a proactive, preventative nature. Let's go ahead and get those 2-minute timer automatic toothbrushes with pressure sensitive bristles. So if you're pressing too hard, it will stop. That helps to prevent any type of attrition or toothbrush abrasion, which can also cause damage to the actual gums. So brushing for 2 minutes in the morning, definitely, if you're able to do so at lunchtime and definitely before you actually will prepare for sleep. Because as the body prepares for slumber, we produce less and less saliva. So now if you have the acquired pellicle, you have plaque, you have food, any type of debris, that is going to be a actual proving ground, a breeding ground for all of those microorganisms over the next 6 to 8 hours, because your mouth is going to be slightly moist, warm, and dark. That is a perfect breeding ground for these microorganisms to disrupt the actual microbiome. Now, there's an old saying in dentistry that you floss only the teeth that you want to keep, which I think is kind of funny, but true. So,
me too.
Yes. So by flossing, you're going to again create mechanical disruption. It is disruption of the colonization of the microorganisms that is going to really help to prevent the actual accumulation of the toxins or the lowered pH, which has been shown to have this acidic type of disruptive kind of, how can I say this? Of just basically
it's the environment. It's the milieu of the mouth. When there's pH lower, it allows for more periodontal and gingivitis problems.
It is. And then you will fall within that 72% percentile. Yes, sir.
Unbelievable. So twice a day to floss or once a day, doctor?
I preferably would say to floss as many times as possible, at least twice. Now you have, right. So you have in the standard American diet, or you have so many patients that say, hey, doc, I brush, I floss. Well, it's not long enough and the frequency is not in accordance with what you're doing. Oh, well, what am I doing?
Okay.
Well, do you sit and snack at your desk? Oh, all the time. So if you're sitting and snacking and and you're consuming complex carbohydrates and you're sitting there with your coffee that has, white granulated sugar, you're snacking on donuts and you're doing this all day, not just 3 times a day, but just all day throughout the day, then you want to make sure that you keep your chompers. You show some love to your chompers. Let's just say that.
Show some love to your mouth. Yeah. Coffee, good or bad?
Well, it's one of those paradigm shifts, Snitch. You listen to some classic literature. Oh, coffee's bad. And then you look at some current
Yeah.
literature and they're saying, hey, look, up to 8 cups a day is great. But really, to tell you the truth, I believe that for a lot of the substances that are in coffee with not all the additives is going to be really good for you. Of course, in moderation,
Okay.
not 8
Of
cups,
course.
maybe a cup or two.
Okay. I have a quick question. It's just a thought. Stuff comes in my head when I hear you speak. Um, what about taking sodium bicarbonate? And since it's that pH that's low that's creating the havoc within the gums and so forth, and once a day, it's just a thought. If it's crazy, tell me. And rinsing with the bicarb to alkalize or take the pH, which is very low, which is acidic for people that are not aware, and moving the goalpost towards more of an alkaline mouth. Is that going to have any benefit? I don't know if it does or not. Just a thought thinking about it right now.
Absolutely. And patients have asked that before, and it's a wonderful question. Sodium bicarbonate, outstanding substance, and it will help to
Okay.
alkalize the actual mouth. Some patients even say, well, what if I consume alkaline water? And I say, well, you know what? Really, to tell you the truth, alkaline water, once it hits your stomach, it's not alkaline anymore.
Of course.
And the second thing is that what would really be beneficial is not only the sodium bicarbonate, but also utilizing nitric oxide in different substances, even your fruits, really your green leafy vegetables, because that's going to help to get a lot of the anaerobic or the aerobic bacteria. It's going to help to really create more of a balance. It just,
Oh, yeah.
yeah, I
Yeah.
don't want to be too technical, but yes, there are so many different things that you can ask you or research
This
that
is
will definitely help.
This has been so helpful. I think it's going to be eye opening to the folks that have been watching this. I want to be very respectful of your time. I see that
Thank
you have
you.
surgeries and things to do this afternoon. The best thing that you could do so far that we learned is keep that microbiome in the mouth healthy and try to avoid ending up with a root canal by doing the preventative things that Dr. Crawford started to talk to us about. By brushing twice a day with maybe something not too hard, but a brush that knows electronic brush, water picking. We didn't get to that, but it's okay too. Using maybe some sodium bicarb, limiting the simple carbohydrates in our mouth, but recognize very carefully, folks, that this mouth is attached to the rest of the body. I want to do part two. I had so many more questions that I wanted to ask. I think people want to know about. In part two, I want to talk about cancers of the mouth that are going
Absolutely.
crazy and rising up now. I want to talk about the more about how to maintain the microbiome. I want to talk about nitric oxide, things of these nature you alluded to. If you consent to that, we'll find a date to do that. But thank you so much. God bless you for being here today. I certainly very much appreciate it. Dr. Terrell Crawford, the master of the mouth, and I'm going to call you Eminem from now on, master of the mouth, if that's okay.
That's fine with me.
For You Light USA. And if you have any questions or anything, look forward to part two. I'm Dr. Mitch. God bless everyone. Talk
Thank
to you
you.
soon.